Hey, how you doing? This is Fred. Just got back from working today in the hospital. Things are getting better. People are less cases, but still, there are people who are very sick and having significant problems. So we're not totally out of the woods, but once again, I have to say you don't know what you don't know. And I want to seriously encourage you that prevention is really the key. You don't want to wind up in the hospital. So make sure that before you even get sick, you do what you can to prevent getting sick in the first place. Because, like I said, you don't know what you don't know. And once you do get sick, if you wind up in the hospital, you know, there are so many things so many variables that can occur that can change the whole course and trajectory of your life. So one of the best ways that I know of in prevention is really focusing on the main key point in health. And there's no health without healthy breathing. That's for sure. If you knew, and like I said, you don't know what you don't know, but when you find out, which through the course, you can get some insight, you'll become to understand why I'm saying what I'm saying. Wish you all the best. Bye for now.
Welcome everyone to today's group session webinar. By the way, my name is Fred. I live in New York. My name is Fred Brown. I live in New York. I am a respiratory therapist. Some of you may know me already, or we've interacted. Many of you we haven't. But I do live in New York, and I just wanted to give you a little overview of how today's group session will run. A little bit of my background, and then we'll talk about what I'm noticing and seeing in the hospital in relation to COVID-19 and how patients are being treated, positive, negative. So that way, not only can you have some insight as to what to expect if you enter a hospital, but also if you have family members who will be entering a hospital, maybe you can give them a little bit of information, a little bit of tips that will help their stay be more productive. And so that's one of the things we hope to accomplish today. Also, I'd like to share with you a little of the application of the Buteyko method, at least in a roundabout way that I've been able to apply it into the hospital and share some of the results. Probably more next week. Today, I'll probably be sharing with you some of the results from the lack of applying it. So we'll see how the session goes. I've been a respiratory therapist for the past 25 years, but I've kind of like been in a very unique situation because I'm in the medical field, and I just want to be clear and transparent today that I'm not speaking to you and providing medical advice, as sure many of you know. A lot of the things that I'll be sharing with you really will be based on my experience, based on what I've seen, and based on my personal experience and personal opinion, and not medical advice. I don't encourage you to go against the advice of your own doctor. It's important that the information that you do take here, oftentimes you may know that it's kind of counterintuitive to what you will typically hear in the medical field, but I also try to share the reasons why, so that way you can make the best assessment as to what you will apply and what you will not. So that's important to be aware of. But my background as in the medical field of studying, as a respiratory therapist, it afforded me to have a, good understanding of how the body functions, lung physiology. And so when I was introduced to the Buteyko method, and how I was introduced to it was basically I was searching online, looking for ways to assist my patients, because many of my patients were asthmatic, had lung problems, lung COPDers, constantly looking for a way to get better results. I came across the Buteyko method in the Breathing Center. And because of that, I was extremely grateful, because I just found that in my experience working in the medical field, we were not accomplishing the results that I was looking to accomplish. I wasn't satisfied with patients coming in the door, treating them, and then them leaving the door, leaving the hospital and being discharged. And then, shortly after, some time, a day, sometimes a week, sometimes a few weeks, they're right back in the ER or in the hospital being treated for the same thing. And so that over time, because I'm more of a holistic mindset and looked at things from a holistic perspective, not just treating symptoms, that always bothered me. And so that's why when I came across the Buteyko method, I was able to, one, grasp a lot of the concepts fairly quickly because of my background, but two, can see how it can be implemented and have a lot of positive effects just based on the principles. And then going ahead and applying the principles really supported and proved my assumptions. As I said, I come from like a holistic background, because even before I went to respiratory school, I was exposed to the field of chiropractic therapy, and just found that to be very helpful for my back condition, and realizing from that point on that the body is very powerful, and if you remove any of its limitations, it can perform pretty miraculously. So very early on, that mindset I developed even before going to respiratory school. But while going through respiratory school, I found that it was very valuable and very informative. I also continued on to for about 2 years attending acupuncture school. So learning some of the principles from a energetic and Chinese medicine. Didn't graduate as a acupuncturist because I was involved with still respiratory, and it was very time consuming, but I valued the information and the learning that I did gain. And once again, it just shaped even more so my thinking of how powerful the body is, and how it can, given the right tools, given the being freed of hindrances, and how it can significantly address its own health challenges. So back to learning about the Buteyko method, when I started to understand the concepts, it made a whole lot of sense. And for some of you who are new, I'll try to, because we have a pretty much mixed audience, I'm not going to get too much deep into the weeds. So as I was coming to better understand the application of the breathing Buteyko method, one of the key principles for many of you, like I said, is understanding, number one, and number two, a key foundation of the Buteyko method, and why it may be counterintuitive to what you've have known before, is that it really involves, one, healthy breathing. And what does that consist of? Mainly healthy breathing from Dr. Buteyko's perspective is that healthy breathing involves decreasing your breathing, relaxed through relaxation, and improving your CO2 level, because that's very much connected to the amount of uptake of oxygen that can occur into your cells. Now, like I said, that's oftentimes in the medical community, CO2 is viewed as a waste gas. But one of the principles that Dr. Buteyko brought to our knowledge is that's the very opposite is true, and that is CO2 is very much connected to the increased uptake of oxygen on a cellular level. And not getting too much into the weeds, but we'll probably talk about this next week a little bit. But even if you look at the concept called the Bohr effect, it really supports this principle. So it's not something that Dr. Buteyko created or invented, but really he, discovered and applied it to the application of the way he was treating his patients. So with that said, that's why you'll see that in the exercises that we do, or in the things that I'm going to be speaking about in relation to the things that we were attempting to do in the hospitals, it really involves those very principles, and that is decreasing one's breathing, relaxed breathing, and helping to maintain increasing your level of CO2 in your lungs and decreasing the loss of CO2 in your lungs. And as I said, the connection between that is the higher the level of CO2 in your lungs, the more on a cellular level, you can have an increase in uptake of oxygen, which we all know the importance of oxygen. And a lot of times in the medical community, the focus is the amount of saturation in your blood. But you have to realize that's not the end-all be-all, having a complete saturation of oxygen in your blood. The key is you want to have those oxygen molecules get to its final destination, and that is in the cell. And that's where the power of adjusting and changing one's breathing lies from Dr. Buteyko's perspective, which was also backed up by oftentimes the results that he was getting, as well as many of the results that you who have experience with Buteyko method have experienced. And those who aren't experienced, I'll share some experiences that I've had in the hospital that also support that theory. And I also want to be clear, it's interesting with my experience with this whole COVID-19, it really has changed the whole landscape of treating the environment of the hospital, first off and foremost, as well as the way doctors are treating patients. Because some of the principles that I've encouraged some of the doctors to incorporate, some of them already had started incorporating some of the principles because they were realizing that their traditional treatment methods, especially with this COVID-19 virus, wasn't working. And so that's why many of the medical community, at least in the environment, and from what I understand in general, the environment in many hospitals, doctors, nurses, health practitioners were pretty much scrambling as to ways to how to manage these patients. And I'll say also this, and this is something getting into some of the things that I've seen from my perspective in treating, going through and having this experience with COVID-19, which is really, I think, a historic event. I mean, imagine who would ever expected a couple of months ago that this was going to affect everyone, nationally, internationally, on a financial level, on a physical level, It's a pretty historic event. And then the whole landscape of, the hospital setting, basically being turned upside down. Who would have even imagined that? But with that said, while at the hospital and dealing with these patients, everyone's really scrambling for ways in which they could manage this disease, this virus. And what we found was, it caused a significant amount of patients to have difficulty breathing because of the improper high dilution of the exchange of the oxygen. We had patients who were giving them 100% oxygen, as much oxygen as we could, and they still were not getting enough. Still, their saturation level was not increasing. And so many of the traditional methods weren't working. But I have to say this, and this is what I was getting to. From my perspective, what I found, those who were at most risk were those who had other issues, underlying issues, such as heart disease, morbidly obese, diabetes. These were the patients that, from my perspective in the hospital, that I found who were, because of this virus, were having life-threatening situation and circumstances. I'm sure there are exceptions to the rule, but in general, for the majority, those are the patients that I found were suffering the most. So with that said, it is a concern for those who have some health challenges. And once again, from Dr. Buteyko's perspective, when you have heart disease, when you have all these other symptoms, all it is an indication from his perspective of, once again, poor health, but a poor, as a result of poor breathing. From Dr. Buteyko's perspective, the underlying factor of all diseases was hyperventilation, was overbreathing. Once again, it relates to what I was referring to before, the loss, of CO2. He viewed CO2 as your main regulator for every system in your entire body. And so that's why it's important to change and promote the way we breathe, as some of the things that I'll be sharing with you. But what I felt is that this whole COVID-19 virus really pretty much exposed the importance of prevention, because it was those individuals who I'm seeing that suffer the most in general are people who have poor immune system, which is indicated by having these other issues, by having an improper level of CO2 and oxygen, improper way of breathing that promotes hyperventilation. And as a result of these individuals having other issues, even before they may have experienced getting exposed to the virus. On the opposite end, you have healthcare workers who fairly healthy, who are getting the virus, but not suffering life-threatening circumstances. Once again, there were exceptions to the rule, and I know some healthcare workers who did suffer tremendously, but I led to believe, because they also had some pre-existing, or their immune system particularly was compromised. But what I'm finding in general is folks who get exposed even in the healthcare setting, if you don't have these pre-existing issues, fairly healthy, then they have flu-like symptoms for maybe a couple of days, a week or two, and then they're right back to work. That's what I'm seeing more on a larger scale than the reverse, where anyone who's exposed to this virus is destined to have life-threatening issues. That's not what I'm seeing in the hospital. But what I am seeing is those who had pre-existing issues suffering tremendously. And so, if anything, I think that's a point to take, that the whole concept of prevention, COVID-19 has exposed, is no longer really an option, no longer really just a nice idea, or, a principle that, just a certain type of, if you have a certain type of mindset, it's just reserved for those people. But really it brings to the table the importance of all of our individual responsibilities of maximizing our health. And one of the things that with the Buteyko method I've found is one of the most important ways that you can improve your health. And if you're not familiar with it, the reason being is, think about it. From Dr. Buteyko's perspective, he spoke of how you breathe more than you drink, more than you eat. You're breathing every second of the day. And so just by the sheer volume, quantity, how often you breathe is one of the reasons why breathing has a significant impact on your overall health. Now, unfortunately, in our society, the focus of breathing isn't, if you speak in the healthcare circles, oftentimes breathing is the one thing that's not spoken about in the general community. But yet, through this method, and the results that people are getting are showing that it's one of the most important, backing up Dr. Buteyko's theory. And I'm sure some of you who have experience can concur with that, because you've seen it not only with yourselves, but with your patients, your clients that you work with. Myself, I'll share with you what I experienced, and that was, I was a respiratory therapist. I am a respiratory therapist. I didn't have health problems. From my perspective, I didn't have breathing problems. So you may say, well, then how did it impact you? Well, one of the things I did notice for myself was within 2 weeks of learning about how to breathe properly, applying the principles that Dr. Buteyko brought to the table, I found that my sleep significantly improved. I was able to rest more efficiently with less sleep. And once again, that's totally counterintuitive. I normally was a person who slept for anywhere on average about 7 hours. And it's typically told, well, you need, 8 hours of sleep, 9 hours of sleep. That's what's typically spoken of. But I found through having more efficient sleep, more restful sleep, more sleep that focuses on healthy breathing, because those are one of the things that we also teach, how to even breathe in a healthy way even while sleeping. I found that I was able to sleep for 5 hours, feel much more rested and much more alert, and the sleep that I did have was more efficient. And so for me, even though I didn't have breathing problems or diabetes or anything significant that I thought of, that's one of the things I noticed fairly quickly. And as I worked with other patients, I've been able to work with patients who were dependent on their sleep apnea, their BiPAP or CPAP machine. And through this method, I've been able to pretty much in about 2 months work with these individuals, whereas they are no longer dependent on their CPAP machine. They were told by their doctor that they would be dependent, but through working with them they were able to actually come off their sleep apnea machine, have more efficient sleep, and stay off. And so once again, we don't treat sleep apnea, we don't treat asthma, we don't treat anything. We just focus on maximizing your breathing so that way your body can address its own health challenges. And between you working with your doctor, as things change, you can make some adjustments and therefore have a higher quality of life and not be dependent on these artificial means of really just symptom care. And so that's really our approach and the things that I've been seeing, and why I wanted to take the time to have this group to share this information with you guys, to expose you to some of the things that I've experienced personally, experienced with my clients, and also we'll talk a little bit about what I've been seeing in the hospital. Now, once again, I'll be transparent with you, and that is, not everyone is, understands Buteyko in the hospital or has totally accepted it or taken the information and run with it. I find that the most effective way, because when you're dealing with the medical community, they already have their mindset on what works, regardless of the outcome. And I say that that's unfortunate. I don't work that way. I work, in a fashion that, if something is working, even if it's, different than what I had presently thought of, if the results are there, I'm a person that I'm more moldable. I change my perspective, which is one of the reasons why learning about this method, why I did change my way that I treat my patients in my scope. So what I had to do, and these are some of the things, maybe some tips for you folks when dealing with the medical community, when in the environment of the hospital. Because you got to remember, when you're in the environment of the hospital, you really don't have control. If you're admitted by the hospital, you're really under your doctor's care. So you have, as a family member, you have limited say-so. You can make suggestions, but really they're oftentimes not open to your suggestions. So if you come and speak with the medical community from a pure knowledge base, oftentimes you will be shot down or not taken seriously. So what I've done was try to think about what is it we're actually trying to accomplish, and speak with the doctors based on their language, based on their terms. So when we talk about decreased breathing, we talk about, instead of not speaking about hyperventilation, which I find, most doctors have a different view of what hyperventilation is in comparison to the Buteyko method. So understand that when you speak about hyperventilation, from my experience, they will, for those who are experienced, they will view that totally different than the way you're interpreting it. And oftentimes that will right away shut down their openness to what you have to say. So I speak more in lines of, decreased breathing. And let me give you an example. One of the things that was a positive through this experience with COVID-19 was that because patients were having difficulty breathing, because they were experiencing low saturation despite as much oxygen and medication and stories that they were throwing at these patients, they started to think of alternatives. And one of the alternatives of treatment, which was, like, to my surprise, but really flowed right in line with what the Buteyko method, almost accidentally, was that they started to prone patients. Proning means instead of laying on your back, laying on their front and having patients lay that way. Now, right away, us who are experienced with the Buteyko method understand that, one, that's one of the principles of how we teach, which is one of the most effective positions in sleeping. Why? Because it promotes decreased breathing. It promotes relaxed breathing. Instead of having, when someone has difficulty breathing, their breathing is oftentimes noisy. Their chest is moving, their belly is moving because they feel a sense of breathlessness. But when laying on their stomach, it helps to calm and promote the relaxation of their breathing through their pressure, and helps to build up your level of CO2 from Dr. Buteyko's perspective. But in the hospital, they don't know that. But they started doing it with ventilated patients. And they noticed that by proning them, by placing them not on their back, but placing them on their stomach, that they had an improvement in their signs and symptoms. They had improvement in their oxygen level. So it started with patients who were on ventilators, and they noticed an improvement. Well, when I saw that, my thought was, that's the proper way in which, the best way, if someone is sleeping, that's the best position that they can be in. And so it sort of supported that. Then it transitioned into, before they even were on life support, on a ventilator, they started doing this, and lo and behold, they noticed an improvement there as well. Patients prior to proning, they were on 100% oxygen. That's as much as oxygen that you can give them. Then, because they were still having difficulty breathing, they oftentimes would get intubated as a direct result. But when we started proning some patients prior to intubating them, we noticed that they were also improving. A patient who had a saturation of, say, in the 80s with 100%, all of a sudden we put them on their stomach. Now their saturation, just by that adjustment, goes up to 94. That literally happened maybe a day ago when I was on shift. We were about to change a patient to an additional oxygen therapy because they were on 100%, and this patient was moving towards getting intubated. But I made the suggestion, why don't you just prone this patient, put her, and before we, make these additional adjustments. Well, they did. Her saturation went from 88 to 94. And we didn't have to make any adjustment in the therapy, and we didn't have to change this patient's room, because we would have had to change her room if we were going to do this additional therapy. So these are that's one kind of positive signs that I'm seeing. So these changes are not only coming from me, but because doctors are realizing what they presently are doing, they're looking for changes, making changes. And they've stumbled on, oftentimes, things that work, but kind of fall in line with the Buteyko method, which is, very interesting. Then what I've been doing also is trying to work with the doctors and encourage them, because one of the principles of the Buteyko method is decreasing your breathing. If a person's not on a breathing machine, they can do that themselves. And that's the focus of our training, of showing folks how to breathe less in general, like making lifestyle changes, but also specific exercises that we do that help promote decreased breathing and help promote decreasing the loss of CO2. That's what we do at the breathing center. But when you're on a ventilator, that patient has no control over decreasing their breathing. So what I've done is really speak with these doctors and try to encourage them to adjust the ventilator settings that would mimic and do the very same thing. So low volumes, like I said, unless you're in the medical field, some of the terms that I'll use, it could be a little confusing, so I won't get into the weeds, but just in general, making some adjustments on the breathing machine so that way it would mimic decreased breathing. Why? So that way it can decrease the loss of CO2 that we are manually doing with the ventilator. And once again, I'll share some more experiences in next week's class. But I've seen it actually, for those who are familiar with the Buteyko, rest assured that even in that setting, even in a critical setting, just like the results that you may have gotten with your clients, I'm seeing the same results with people who are on life support, being able to get off life support significantly than your average patient who were not utilizing these principles. From people where we're not applying, where we're using higher volumes, which promotes hyperventilation, and to the medical community, that's normal care. When you talk about low volumes, to some understand that the concept of small volumes being beneficial, but the majority, this type of therapy is viewed as aggressive. Patients are getting off of the ventilator much quicker. They're getting positive results by making these changes that mimic the Buteyko method that we normally would do with your average person. But the way they oftentimes view this, because it's different, is they view it as aggressive. Even as we're getting results, I still receive some resistance. Why? Because it's not in line with how patients are normally treated. But see, the reason why, one of the things that's motivated me is that COVID-19 virus has produced the rate of mortality, patients dying, anywhere from, if you're on a ventilator in New York, we're seeing that it's like an 80% mortality rate of patients who go on ventilators don't make it. We're seeing that not only in general, and it has a direct result from my perspective and understanding the Buteyko method as a direct result of not the virus itself, and this is my personal opinion, based on my assessment, based on the things that I've seen and making adjustments and seeing the results. That is direct result of not the virus itself per se, but the mode of ventilation, the way they're ventilating folks that go opposite to healthy breathing. I found that to be very fascinating because we weren't able to see those kind of results, those kind of statistics prior to COVID-19. But with COVID-19, like I said, because of the increased amount of people who are requiring ventilation, being placed on a ventilator, we're seeing those statistics that, those who are being ventilated by the traditional method, which is hyperventilation, 80% mortality rate. I'll share with you next week the rate of, now that we're seeing, at least in the areas that they're applying these principles. Next week, I'll share that with you and give you the change in stats. because some doctors organically have started to gravitate towards those means of treating the patients in line with, Dr. Buteyko's method, not necessarily knowing it, but in line with it. So what I do as I come along, and at least when I'm on staff and working with the doctors, I support their approach moving in that direction. And so next week I'll share with you a little bit more about that and the results on the opposite end. But the results on the negative end is that, I mean, there were times during my shift when we were, intubating like 4 people, like within hours, and by the end of the shift, not necessarily those patients, but other patients who were on ventilators. I mean, it was not common to experience having 2 and 3 people dying that were on ventilators in one shift. I mean, prior to this COVID-19, it was totally unheard of. So it is a serious issue. But once again, I emphasize, from my perspective, it's serious with those who really fall into that category that need to be most concerned. But if anything, all of us, I think it's important to be concerned because we have the opportunity to change our breathing, which can relate to a change in our overall health, support our overall health, support our overall bodily, systems before we are even exposed to, whether you're talking about COVID-19 or any other issues. Prevention is really the key to health. Now, if you have health challenges, if you are sick, well, just in the same, what can prevent you can also have the support, the opportunity to help increase and get you back to baseline. And so from Dr. Buteyko's perspective, most powerful is your breathing. And we see these kind of results time and time again. And so normally folks do not recognize the importance of breathing. So, if a person's not exposed to this method, this training, don't expect people to be knowledgeable. But the results are there. And I just want to, just kind of provide some of those. So that's tip number 1. If you do have some health challenges, if you do have some difficulty breathing, you don't have to wait to go to the hospital to change your adjustment. One of the ways you could do is prone yourself. Lay down on your stomach, best case scenario, that will at least promote the increase in uptake of your oxygen. So that way, that alone may be your prevention that could give you a little wiggle room before having to even go to the hospital if you do get exposed to this virus. It can and sometimes does cause breathing trouble, because of your immune response and the pneumonia that can develop as a result. So it can affect your breathing, but that's one of the things that you can do. If you have difficulty breathing, don't hesitate, go to the hospital. But on the early stages, that if you apply some of the principles that we talk about during our session, it could prevent you from your health challenge escalating to the point where you need to go to the hospital. So early stages is the key where you want to be applying these principles. Once you've passed that early stage, a more crisis situation, then I don't recommend waiting or, skilled enough to apply these principles effectively. Go to the hospital, because it's better to, get the treatment that you need, especially if you're past that early stage, especially if you pass that threshold. So that's important. We do work with clients to give them a little bit more instruction and detail of what to do, but that is something that requires training and further instruction. But never hesitate to, if you are in a crisis situation, even the things that we say that could possibly happen in the hospital, that's your best course of action, at least to get you over the hump, and then go back to your healthy breathing. Go back to applying some principles that can significantly impact your overall health. So one of the disadvantages that I found in applying the principles in the hospital, and it's really not a bad disadvantage. It really promotes, once again, the importance of doing these things outside the hospital. And that is, in the hospital, the Buteyko method goes beyond just breathing exercises. It also incorporates lifestyle changes. And sometimes those lifestyle changes can be more impactful on your overall health than the breathing exercises itself. When you combine the two, it's almost like synergy. So in the hospital, I can't go into lifestyle changes. That's out of my scope of practice as a respiratory therapist. And so that's the disadvantage of, applying these Buteyko method in the hospital, because can't really get into lifestyle changes, can't really get into things that they may need to do on a daily basis that can really support and substantiate their overall health. But the fortunate thing is that you guys do. You guys have the opportunity to get exposed to the education, the training, whether it be through some of the things I'll share later on. We have a book available, Breathing to Heal, or videotapes, so that way there's a low cost, low entry of getting this information. And then we also have personal training that you can work with a specialist, such as myself or someone else in the organization. And that's the best way, because oftentimes the information is good to establish a foundation, but to really maximize that foundation, you may want to consider working with a specialist, so that way they can customize the method, customize the training, the information that you receive to your specific situation and circumstance to maximize your benefits. But in the hospital, you don't have that option. I'm merely just isolated to maybe adjusting their breathing, having them to relax. And sometimes that within itself is powerful enough. I've seen just encouraging my patients to have more awareness of their breathing, because that's first and foremost, developing an awareness of our breathing. Most of us are not aware of our breathing, don't realize that breathing through the nose is your most healthiest breath that you can take. And breathing out your nose, not breathing in through the nose and out through your mouth. Oftentimes when I speak with people about breathing, they often think, well, I breathe, I know how to breathe, because I breathe in through my nose and out through my mouth. Not from Dr. Buteyko's perspective, that's not the healthiest breath that you can take. It's in through the nose. Why? Because your nose is the very organ that conditions the air for your consumption. What do I mean by that? Your nose is your main filter. That filters the air. When you breathe through your mouth, the reason why it's very dangerous is because it goes right into your lungs, unfiltered air. So the microbes, AKA the viruses, they're going right into your lungs and can increase the level of your being sick, whether you have a health problem or not. It affects your tonsils and so forth and so forth. So that alone is one tip that you can apply, having more awareness of your breathing and breathing through your nose. Not only does it filter the air, but also humidifies your air. Your nose is your humidifier. And your nose is your temperature regulator. Plus, related to what we're talking about today, it's significantly important, and that is your nose creates an environment which is hostile to viruses. So if you're breathing through your nose, even if you are exposed, you have an additional layer of protection by breathing through your nose. So that way you decrease the potential of you getting sick. And I say this whether you have a mask on or not, because when you have a mask on, air can still slip through your mask. And so if you're breathing through your mouth, especially because you have this mask on that oftentimes promotes people to breathe through their mouth more often, you're still missing out on a layer of protection. Your mask can be one layer of protection, but the fact that you're breathing through your nose, that's an additional layer of protection. And that layer of protection is there whether you wear a mask or not. And so that's important. The other principle is that sometimes realize that according to the medical community, the typical cloth masks that people wear, if you're the COVID-19 virus, according to the medical community now, it can pass through those masks. So it doesn't provide the level of protection that, and may provide a false sense of protection, the typical cloth mask. That's why it's been a hot topic, the N95 masks. Those are designed to filter out smaller particles. And according to the medical community, not according to Buteyko or according to me, that's the mask that really has the true protection if you're just relying on your mask. But myself, I rely on my most important layer of protection, and that is nasal breathing, whether I have a mask or I don't have a mask. So that can be an additional tip for you, that as you learn how to focus more on your breathing, become more aware of your breathing, and focus more on nasal breathing, in and out, that within itself could be a key prevention, as well as help promote improving your overall health. That also could additionally give you a layer of protection and prevention of getting sick in the first place, as well as recover. I'll tell you, working in a hospital, now I feel prior to the whole explosion, I felt I had the coronavirus. Now, I don't know that for sure. I will be getting tested for antibodies just to confirm or deconfirm that, but because of myself working in a hospital, I know about 2 months ago, I developed a dry cough, I had 103 fever, and I had a headache. And I rarely get sick, but I had those experiences. So what did I do? This is the way I treated myself, and that is focused on my breathing, relaxed, took 2 days off, had 103 fever for about 2 days, and after that, I was fine. My temperature broke, I was back up and about. And that's the way I approached it. So to me, even if we're talking about I had a virus and not the coronavirus, either way, once again, I try to apply practice what I preach. And those are the results that I got. And like I said, I plan on taking a test to confirm whether it was a coronavirus, so that I can say, yes, I actually did. But regardless, this is what I'm finding. Improved health when you really focus on, first and foremost, your breathing. As I said, 3 ways that promote healthy breathing. One is breathing nasally and incorporating movement. Because movement, any type of movement, increasing your cardiac output, helps to promote a CO2. Also, relaxation is another principle that helps to promote healthy breathing. And the third principle that Dr. Buteyko brought to the table is decreased breathing, right? And in this exercise, some of you are familiar with it, some of you may not be. It incorporates those three things, right? And I'll just first demonstrate it and then talk about it a little bit, each piece. So the first part of the exercise involves rubbing your hands together, right? And this is to generate heat, because we want to view our hands as our super healer. It's going to help to promote health and vitality and energy. But the movement itself helps to, is physical movement, can help get your heart pumping a little bit. And it involves maybe moving certain muscles that you're not normally used to moving, like the whole concept is you don't use it, you lose it, that is definitely applies to, muscles. So when you're using these muscles that you normally don't use, you may feel a little sensitivity afterwards, but that's good. So that's the first part of it and I'm just going to first talk about each part and the application, and then we'll do the exercise. So it's the movement. We want to generate heat, and then we will place that onto, say, our faces, and that incorporates relaxation. We want to use our super healing hands that takes that vital energy and almost give us yourselves like a massage, an energetic massage, where you're using that energy from your hands, from the super healer, and helping to relax the face, helping to relax the tension, right? And so that's part 2 of the super healer, right? Which incorporates relaxation. And the more that you're relaxed, the more your breathing is going to be decreased, and it helps to promote CO2 and helps promote vitality and health and energy, right? And so the third part of the exercise will incorporate decreased breathing, right? And how do we do that? After we do the second part, we'll engage in what's called humming. And humming, pretty much what it is similar to like a breath hold. By humming, you're decreasing your breathing because you're not inhaling and exhaling. You're kind of like taking a little break. And that break, that sort of like hum, will help to decrease your breathing and help to promote the level of CO2 in your lungs. Then after the hum, what we'll do is do a minute of relaxation, focused on relaxation, and that will also promote decreased breathing, followed by what we call a breath hold. And all a breath hold is just inhaling lightly, exhaling lightly. It's always done on the exhale, and then holding your nose. And I would say for most of you, if you're not familiar with the Buteyko method, you hold your nose for about 2 seconds, 2-3 seconds. Once again, what is that doing? That's decreasing the breathing, decreasing the amount of ventilation, inhaling and exhaling. And so that's just 3 ways in this exercise that we incorporate the principles of the Buteyko method. That's perfectly fine, but what you don't want to do is hold it to the point where it causes you to take a deep breath in. That means you've held it too long. My encouragement, if you're new, just hold it for 2-3 seconds. That will be perfectly fine. And the Buteyko method, we want to make sure it's done without stress, because if anything that I'm sharing with you causes you stress, causes you anxiety, then skip that part. Just skip right over that part. Because one of the things when you're working with your breathing, it's really coming from a perspective of gentle, being easy, and being light. Very different when we think about exercise. Oftentimes, you know, the principle is no pain, no gain. Well, that's not the case when it comes to breathing. It's the opposite. If you push your breathing too much, it will rebel and you won't get the results that you're looking for. So with breathing, you want to make sure that it's always done gently and without stress. And so, all right, so this is called the super healer. So rub your hands together, get the energy up, right? And feel the warmth. Feel the warmth. And now you want to take that energy and that vitality and place it on your face. And as you feel, just give yourself a loving massage. This is your time to take and love yourself. Transfer that energy into your muscles. Enjoy that energy. Be receptive. It's really about giving and taking. Give yourself the warmth, the vitality, and receive it. Wherever you feel tension on your face, just enjoy. Allow your hands know where to go. Imagine and think about, and imagine that. Just let them go where they need to go. Right? And as you're enjoying that, take a moment to enjoy that, receive it in. And now relax through, now the hum, as I said, is a and that's a way of relaxing and reducing our breathing. So you're basically humming and making a long, continuous hum to the point where you're comfortable. And then now, after the hum, for a minute, just relax. Focus on relaxation. Focus on decreasing your breathing through relaxation as I put my timer on. And for a minute, just breathe lightly. Breathe comfortably. Breathe enjoyably. Continuing promoting decreased breathing. It's just an exercise to help decrease breathing. You're going to take a small invisible breath in through your nose and a small invisible breath out, and hold your nose for 2-3 seconds. However long you're comfortable for, without a forced air. 2-3 seconds should be good. Now we're going to go back to rubbing our hands. Once you're done rubbing your hands, and don't push your breathing. Remember, make it gentle. Very, very gentle. Okay, now get that heat up. Move those muscles. And now continue with the super healer. Now touch the the top of your head. Take that energy and transfer it to your head, to the muscles in your head. From a Chinese medicine perspective, there are a lot of acupuncture points on the top of your head. So not only does massage is helpful for the muscles, but also for various points it can help promote. And so we normally don't touch our head, but now you're able to touch your head, relax the muscles. Once again, it's all focused on relaxation, which ultimately focuses on decreased breathing. And that's the connection. Yeah. Now we're going to, once again, decrease the breathing more by doing a long hum. As long as you can do it. And once you're comfortable, if you can do it longer or shorter, that doesn't matter. The numbers don't matter. Now you're going to do relaxation. We're going to relax for a moment, for another minute. And why relaxing? It feels good. Oftentimes we do need to take a break from our busy lives, focus on ourselves. And most important, it helps to promote relaxed breathing. And so as you're there, just focus on decreasing your breathing through your nose, taking in as little breath as you can, and then maybe a little less if it's comfortable. Well, I hope you enjoyed that. It's a principle that you can apply. So when we take a few moments, I'll take some questions. I see someone's hands up. All right. Did you have a question?
Christina, hi.
Hi.
Hi. Thank you very much for this class. I have a question. So I'm Kundalini yoga teacher, and last week only I've been exposed to Buteyko method. So now my question is, did all the Buteyko methods go against the yoga? Because now I see it's very much contradiction, because in the classes we teach students to breathe deeply, to breathe a lot, to use the mouth. Sometimes we ask them, open your mouth and breathe through the mouth in many pranayams. So now I'm totally lost, and I wanted to know, was Mr. Buteyko against yoga in general? Like, how do these two go together?
Great question. Well, in fact, many yoga practitioners experience health problems from engaging in that type of breathing, right? And it's not so much the yoga itself, but just the way they're instructing folks to breathe. And so we offer, you can still do yoga, but do it more from the perspective of healthy breathing. And then once yourself, allow yourself to experience the difference. There have been yoga instructors who have, because of that way of breathing, have developed sleep apnea. And when they changed and addressed and promoted more healthy breathing, they were no longer dependent on sleep apnea. That's not a common thing. And I'll talk about a little bit next week that it relates to whether you're talking about yoga or any other exercise. That's why I mentioned exercise can have negative impact. Even though some principles of exercise are good, if you don't incorporate the breathing, oftentimes it will have, over time, a negative impact, right? And so that's just something to consider and something to try. And as you learn more about the Buteyko principle and why, I think the physiology of how our systems work, it makes sense and in line with Dr. Buteyko's method. And when you start applying it to exercise, all forms of exercise, you'll see the why and how it makes sense. And ultimately, the results, speak for themselves. There are people who have a higher level of health that may be able to do certain breathing exercises that will incorporate deep breathing, what have you. But most folks have a misconception of, one, their level of health from a breathing standpoint. And we do measurements, probably next week I'll talk a little bit about that, a way of measuring your breathing to see how healthy it is, the level of health it's at presently. And through the exercises, through making changes, through making adjustments, those levels change, right? All right. Was that helpful?
Yeah, thank you.
Okay, thanks for the question. Next, we have Christine. You're unmuted. Wait. 1 second.
Thank you, Fred.
There you go, Christine.
Hi. So I have an underlying condition. I have COPD and bronchiectasis. I'm sure you've dealt with patients.
Mm-hmm.
So I have a pulse oxy monitor.
Yes.
I'm actually dealing with a virus right now. And they gave me the COVID test yesterday, so I'm awaiting that.
Okay.
And after a threshold, you should go to the hospital. And they told me, if my oxygen level dips below 90. But what's your recommendation? Because it's kind of scary when you go there, like you said, you lose all control and they might ventilate you or do something that makes it even worse, So
Sure.
what's your recommendation? They told me 90.
Okay. So once again, I just have to be clear. I can't give you a recommendation because I'm not giving medical advice.
Okay.
I can only give you my, what Fred would do and my personal opinion. And so you have to take that and adjust it to your own situation and circumstance. Because it's unfair for me to give someone advice when I don't have the details or really not interacting with you. But so I'll talk in general. And that is, yes, that is wise to monitor your oxygen saturation. That's why I also shared prior to that, there are things that you can do to help increase and promote before it gets to a point where it's really bad. So today we talked about the way you lie down, the way you sleep, and adjusting your sleeping. Like I said, in the hospital, they're proning patients who are severely sick and they're getting results. How much more someone who is not that sick and maybe at home and trying to manage their own situation and circumstances, why not incorporate these principles that are working in the hospital for sicker individuals? So those are one of the things that you may consider doing, and that is resting more on your stomach, your chest, and if that's significantly uncomfortable, then on your side, but definitely not on your back as a recommendation, because Dr. Buteyko's perspective, that was the worst position for sleeping that promoted the most level of loss of CO2 or promoting you breathing through your mouth while lying on your back. So those are some of the things. Also, doing the exercise that we talked about could be a great instrument that you can use to help improve and support your overall system before you get to that point to where you already know your system's a little compromised. It would only make sense to do things that can promote and support your system before you even have to go to the hospital. But if for some reason these things don't work, are not effective, or you're not trained enough to really properly apply them, because just a session, hour and a half session, enough to really sometimes drill down on the finer details, so that way you maximize your benefits of this method. But if you apply it appropriately, you should get positive results. But end all be all, if you get to that threshold, don't fear not going, because once again, you can continue to incorporate these things in the hospital. And it's best to get the emergency treatment that you need than not. you know. So you may need that just to get over the hump and get better that much quicker by continuing to apply these things. Does that help? Hold on.
Hi.
Did that help, Christine?
Yes, I was about to type a question. I just had a technical question. I have done the Buteyko method.
Okay.
And it's definitely helped, but it hasn't cured my bronchiectasis. I wanted to ask about the proning technically. So you recommend if we can, we sleep on our stomachs all night long, and also with or without a pillow, just the technicalities of proning.
Sure, sure. I find, well, what we do in the hospital is we typically will put a towel underneath their chest just to kind of give them a little bit more wiggle room, you know, as far as between, you know, so when they're on their face, then it's not so, you know, kind of turned. It's a little bit more this way. So those are some of the, you know, so definitely if a pillow is comfortable placing on your chest, however it may be, you can make those adjustments. Anyone else have their hand? Pronunciation of names, if I'm not familiar, is not my strong point, but Vera?
Vive is short for Genevieve.
Okay, Genevieve. How can we help you?
I'd just like to tag on with the use of pillows, proning. Did you pillow under your head and towel on your chest, both? That's what you meant?
Yeah, what we have done in the hospital is we would put a towel underneath the chest, and what I typically did, which I found to be very useful, is taking an IV bag, wrapping it in a chucks, and putting that right along the side of the head. And it almost acts like a waterbed type of thing, but also elevates the head and kind of turns it a little bit this way opposed to being like this, and provides a little cushion. And so instead of having it completely across the face, I would have it slightly at the back of the head to help best position the patient. Because I found, remember, with these patients, they're usually not alert, and so they're not able to adjust themselves. Whereas different if we're at home and we apply these principles, we can adjust ourselves.
Okay.
Good question.
Thank
you. You're welcome. Anyone else?
Yes. Can you hear me?
Yes, I can.
Oh.
State your name, Sherry?
I'm Sherry.
Okay, Sherry.
I have a mild case of sleep apnea, and I find sleeping sitting up is not very much as fun as lying down normally, but I sit up. What do you think of that? Because I seem to have a better breathing experience there.
Yeah. Yes.
No apnea, in other words, I don't think.
Yeah, and when we say laying on your back, from Dr. Buteyko's perspective, and thank you for that question, Sherry, we talk about flat, laying flat. We find that to be the most unproductive in promoting healthy breathing. But definitely sitting up is oftentimes a good way, an additional way that's recommended, either on your stomach, on your side, or in like an upright position. Yes. If you have like an adjustable.
Well, I find sleeping on.
We oftentimes in the hospital will. Say that again, Sherry?
I find sleeping on the stomach is kind of difficult, a little bit uncomfortable.
Not a problem. Yep. And and that's why I said anything that you find uncomfortable that we suggest, then don't do it. You want to, it's not like a cookie cutter where one thing is best for everyone. You want to take this information and adjust it based on your situation and circumstance.
I think a good thing then would be to just try it one night a little bit and try to work up to really sleeping more on your stomach.
Yes.
Big help, then why not?
Exactly. Exactly.
Thank you.
You're welcome.